A relaxation of COVID restrictions will see the end of most vaccine mandates, but who does that impact, and is the loosening of restrictions too soon? COVID-19 Minister Chris Hipkins joins us. Good morning this morning, Minister.
Good morning.
So we've heard a lot about how this is going to affect immunocompromised children, but just 5 to 11-year-olds in general, they only became eligible for the vaccination on January the 17th, so only eligible for their second dose 8 weeks later, which was last week. Is it unfair to put them at more risk than the rest of the population, given they haven't had the chance to get those 2 doses in?
Well, ultimately, the relative level of risk is changing very marginally compared to what it was before. So, removing the vaccine mandate for the education workforce doesn't mean that all those people who have been vaccinated now become unvaccinated. So, we'll still have very high rates of vaccination across the country.
But you are saying that children aged 5 to 11 who have not had as much time to get a second dose are able to be with unvaccinated teachers, therefore putting them at more risk as the rest of the population because they just haven't had their vaccination rates as high as the rest of us.
Well, the reality is that even their vaccinated teachers can still get and pass on Omicron. So things have changed quite a bit. Omicron has changed the game quite a bit since we've put those mandates in place. We were dealing with Delta and earlier variants when we made the various mandate decisions that continue to be in force as of today. And the world has changed a lot. The virus has changed, and we need to recognise that in the rules that we've got in place.
Boards of trustees will be able to make their own decisions about whether to drop the mandates. Is that putting undue pressure on schools to have to make those decisions? They'll be under pressure from parents who do and don't want to, or put them in an awkward situation?
Well, school board can't say we're just going to keep the across-the-board mandate in place, but they can do individual risk assessments where there might be a special set of circumstances that might warrant a vaccine requirement of some sort. So, one of the examples might be if they were dealing with immunocompromised, if a particular staff member was dealing exclusively with immunocompromised children, there may be a case to have a requirement in place there. But ultimately, schools will have to make those decisions, and I'd suggest that they'll need to get good legal advice as they're making any such decisions.
Okay, so if they choose not to let unvaccinated teachers back in, are you saying that they might have a legal issue?
Certainly, if they tried to impose an across-the-board mandate, there isn't a legal basis for that now. And so, I think school boards would be well advised to make sure they're getting good, robust advice in any decisions that they're making in these circumstances.
So is that going to be the same for the private sector, for employers? Are they going to find it tricky to be able to keep that across-the-board mandate?
Again, I would encourage any private sector employers in the decisions that they are making to make sure that they're getting good advice, both public health advice and legal advice. The basis for any decisions that they're taking here need to be very sound public health advice, so that it needs to be proportionate to the risk. And obviously the risk has changed, and therefore the legal position has changed in the last few weeks.
So you're saying perhaps only private sector businesses that have customer-facing roles that are dealing with healthcare or people who are vulnerable would have a leg to stand on to keep the mandates, but others wouldn't?
Look, I'm not going to provide legal advice. There are a whole bunch of court cases currently before the courts, which I think will provide some steer here as well. But ultimately, my message to employers would be to make sure that they're getting good, sound advice before they make any decisions.
The hospitality industry is ultimately welcoming these changes, but they're saying that for small and medium-sized businesses, which is the vast majority of our hospitality industry, the spaced and seated restrictions will make no difference to them in the meantime while we're still in red. They're pointing to inconsistencies too. You can go out and play a game of rugby with people, but then if you're going to go and have a beer with them afterwards, you have to be all spaced out. So why keep those restrictions in the meantime?
It's ultimately the decisions that we've taken there are ultimately based on what we know about where the virus is more likely to spread. In an outdoor setting, there's not evidence that there's a particularly high rate of spread. Indoors, in those kind of environments where you're sitting around in close proximity to others, we do see much more spread in those kind of environments. Particularly if you're talking about hospitality, you won't be wearing a mask if you're eating and drinking, and so there is a greater degree of risk there.
COVID-19 Minister Chris Hipkins, thank you very much for joining us on AIM this morning.